our topic today for everybody is about proprioception and balance at midlife. Part of the reason that I'm excited to speak about this with you is that in midlife, many people are now finally getting interested in building strength, which is terrific. And they're also finally starting to pay attention to their bone health, which is also terrific. But the issues of balance often are something that, while we both know they should definitely be addressed at this point in life, many people don't start to think about it or until either later in life or consider it more of a senior concern. And yet we both know how balance starts to shift dramatically at this point. So I'm just going to dive right into some questions with you today.
Okay.
So the first one is to tell us, because we have both people who are exercise professionals, we have people who work with exercise professionals as clients, and then we have people who are just trying to figure it out for themselves as well. So tell us, what is proprioception and how you improve it?
Absolutely. So proprioception, you can think of the word ception, which is perception or awareness. So proprioception is very specific to our joints, but also kind of our muscles and our body in general. And it creates this sense of awareness. It's very much incorporated with how we move, because the quality of how we move is based off of how we feel where we are in space. That's really where proprioception comes in. You could dive a little bit deeper and say that proprioceptors, which are nerve endings, are found very specific around joints. It's in the joint capsule. So when you stretch the joint, you are essentially stimulating the brain, and then that helps to control the movement. That's taking it a little bit deeper. Or you could stay high level, proprioception, your sensory stimulation, your perception of your body in space, and then that is used to control movement. You had mentioned balance training or balancing. Balance and proprioception are very important with each other, because in order to balance well, you have to know where your foot, ankle, knee, hips, lower back are in space.
Absolutely. So then, for probably more of the people who are coming from the professional side, here's a question about telling us the difference between proprioception and mechanoreception, which might even be a totally new term for people out there, but hey, this is all about education.
Exactly. So all of these different nerve endings and perception of the body, that's essentially what we're classifying. So proprioception is one, mechanoception is another. I love mechanoception because that's where I get to talk about the feet, the bottom of the feet. And mechanoceptors are nerve endings that are on the palm of the hand and the bottom of the feet. They are essentially touch nerves. So when you touch the ground with your bare feet, if I touch the table, I have something here that's textured, that I'm holding it, I'm stimulating mechanoceptors. That's a different type of nerve ending than proprioceptors that are in your joints. So if we take the foot and the ankle as an example, foot, ankle, you obviously have joints in there. The joints, such as the ankle, is going to be proprioceptive because of the joint capsule, the tendons, the ligaments. And then the skin in the bottom of the foot is going to be mechanoception, which is a little bit different nerve. They always work together to feed the nervous system to know where you are in space.
And that's a really great distinction and explanation that I think is possibly the simplest that I've heard before. So I love it. So tell us more about, with these receptors, various receptors in the foot, and also, you've mentioned the ankle, but tell us more about, I guess, then the mechanoceptors in the foot, how those change with age. I've seen something about how the sensory stimulus and our ability to interpret that input changes around age 40, which I think is a shock to most people. And tell us more about this.
Yeah, 100%. So as a functional podiatrist, I'm obsessed with the nervous system. I'm obsessed with movement, but if you think about movement is controlled by the nervous system. And I was actually just listening to a lecture from Dr. Amen of the Amen Clinics, and it was all about protecting the brain with age, and you have to make those decisions now earlier in life to think about how is your brain going to be in your 60s, 70s, 80s. You can't react when it comes to the nervous system and nervous system health. And that involves also your peripheral nervous system, which is your feet, your hands, this extension of the nerves. That's mechanoception and proprioception. Both of those nerves, through just age, inflammation, disuse, chronic footwear, injury, whatever it is, starts to become a little bit less sensitive, a little bit slower. I'll give an example of where this could happen. Is we control our ankle, again, through this interplay of mechanoception and proprioception. So we've all experienced at some point where you're walking and you step off of the sidewalk and you have a little boop, like a little misstep, right? And when you're a little bit younger, kind of like your peak training, things like that, you feel the slight shift and then you quickly correct it and you're like, woo, save that ankle sprain, right? Or that fall. As you get older, the slight ankle sprain, that movement, the misstep off of the curb, it's like it's in slow motion. So you're starting to stretch the ankle and you're moving into this position that is about an ankle sprain or a fall. Your center of mass is moving forward and you don't feel that stimulus fast enough to correct it.
The reflex.
So now you've,
response.
right. So it's kind of this delayed perception is really what it is. It's a delayed perception that leads to a delayed reaction time. That's where you sprain your ankle, or that's where you fall. And I've had many patients, especially living in New York City, which is like the walking capital, and they would fall because they misstepped on the sidewalk, or they would have major fractures and sprains because of a misstep off the sidewalk. And that is a direct indication of their lack of perception or delayed perception of that movement.
And so related to that, it's one of the most obvious questions just that comes up to mind is for people are going to ask, how can you improve that? So how can you change that? So that, along with, this relationship of what you've already explained of how it affects our balance, but you started going into something also about reaction time, which, we can also come back to in another conversation, because I think this brings us more into implementation of exercise. So I'm going to save that for later, I think. But you're bringing us into the whole bigger picture of, you were saying being proactive, essentially, rather than reactive. How are we going to be proactive to acknowledge that some of these changes are happening now for these decades to come? So along those lines, how much of this is related to hormones and hormone changes? So how do hormones then specifically affect this?
So really where I would look at the hormones and shifting in hormones, specifically female hormones, is going to affect connective tissue. So let's focus on, everything is collagen, essentially, or a lot of things. The connective tissue is in the ligaments, in the tendons, and this is where those nerve endings sit. Now, I wish I had a beautiful picture of an ankle with ligaments, and I apologize that I don't, but let's picture that there's these ligaments on the side of your ankle. This will be my ankle for now. And a ligament is not stimulated until it's at the end stretch. So you have to stretch it fully, and then it's like, I feel it. Okay. So if we start to get this laxity and a changing in the integrity of the connective tissue with shifting hormones, you're not getting that signal as fast enough because it has to stretch further to get you the signal. So that's where you could start to see, okay, there's a shifting in my perception or the timing of the stimulus because of changes in connective tissue. That's how I would have it. Another area where I see this is that with hormones changing, we start to get changes in really all of our connective tissue. Maybe your morphology changes a little bit, maybe gain a little bit of weight in the hips, the stomach, wherever it is. But we have a changing in our morphology, which then goes back to your perception of that morphology, which is called body schema. And body schema is one of my favorite things to speak about because it is your mind's eye or your mental picture of your body in space, right? And this is subconscious. So when we walk and we navigate in the external world, your mind has this picture of your size and shape. And then as I walk down the sidewalk, let's say we're back in New York, we walk down the sidewalk, love New York. You're walking down the sidewalk and it's busy. So there's people, right? Back and forth, back and forth. You have to walk past people. People are coming towards you. You have to go this way through them. We are continuously in the background of our brain navigating, okay, can I stay like this? Or are they, I would actually hit them because they're in line. Or, right, do I have enough space? Do I just kind of move my shoulder at the last second as someone walks past me? That part of movement and the way that we relate our movement to the external world is very, very important. That is one of the most overlooked components of aging effects on movement and movement longevity is your subconscious perception of your body in space. That is a neurological process. That is a proprioceptive, a mechanoceptive, all this interplay, and it's fed through your connective tissue. And your connective tissue is essentially an extension of your brain. So if that shifts because of changes in hormones, it's going to affect everything else.
Absolutely. And then, so the schema that you're saying is different from proprioception in the sense that the schema is also our awareness of us in relation to the outside, as opposed to the proprioception being more internally based of my perception of where I am within space itself.
So you use proprioception to feed schema.
Okay.
And schema is a skill. It's a mind-body practice, and we lose it with age. Just kind of like everything else that we were speaking about, hormone related or not, we start to lose a connection to our schema. This is why, and I know that they don't say this at the end of the research around certain methods like Tai Chi and stuff like that, but they're like some of the best practices for people who are over age 60 is Tai Chi, yoga, meditation, right? They're mind-body connection methods. And they're like, oh, it's because you're kind of tuned in. I'm like, it's because they're connecting to their schema, to their subconscious awareness of where their body is in space. And we lose that, right? People get clumsy with age, right? And that clumsiness, this exact same thing I love to speak about, the end caps of life. Because I love to speak about this with children also, is that children are building their neurological library, their movement library, their mind-body library during their, really a lot of that's happening through newborn to 7 years old, and then it continues, even past teenage years, because your brain doesn't fully develop until you're in your early 20s. So all of that is still shaped, right? Same thing is children who are clumsy. It's a reflection of their inaccurate perception of their body in space. Any of us or our clients, even at 40 years old, if you're clumsy, it's an indication of a lack or a slowed or a dysregulated perception of your body in space and how it moves.
I love it. It's you're bringing so much together of various concepts and uniting everything. And especially, we just did a webinar last week, actually, with several specialists about mind-body practices and movement. And one of the things that came up was this discussion of the nervous system. And I love how you're tying in this idea of schema, which now makes even more sense of some of the other elements we were talking about with nervous system regulation and HPA axis and such. So now we're adding in another element, everybody, of the schema, which is terrific. So I'm gonna go a little bit more granular now with you and talk about some specific foot issues that we see all the time that I think people are not necessarily piecing together in this midlife discussion. People are talking a lot about joint pain, and this is something that we focus on quite a bit in our approach to bone and joint health. And different pathologies that come up, like frozen shoulder or various tendinopathies and increased hip pain, hip tendinitis and such, lateral hip pain, what people used to refer to as bursitis. But I don't think people have made the connection with everything that's fascia related in the foot. So one thing we hear a lot about, and I keep hearing from a number of people, is, oh my, this plantar fasciitis just starts flaring up. So let's go straight to the foot expert here and talk about some of the common foot pathologies and just issues that arise at midlife. What are some of also your favorite ways or quick, any quick tips that you might have for how you like to treat them?
Yeah, so I think one of the first ways or most important ways to go into it is that there's a lot of connective tissue in the foot and the ankle. There are over 100 ligaments. There's a lot of those ligaments sitting on the top of the foot that are part of the interconnection of these small joints that hold the shape and the posture of the foot. So if we are starting to get a little bit of laxity, this is also very similar how in pregnancy as relaxin goes up, we can start to see a widening and a flattening, or your feet get bigger when you're pregnant, is because of the effect of the connective tissue with different hormones. So we can start to lose a little bit of our foot posture, the structure, the mechanical structure of the foot, which could be putting some changes onto the plantar fascia, because you happen to mention that. Your plantar fascia is connective tissue as well as a thick band of connective tissue that is used like a rubber band. So every time we walk, we start to experience and stretch that fascia to load and unload energy. That's essentially the mechanics of your plantar fascia. If hormones are changing the rubber band effect of the plantar fascia, then that's where you can start to get these hormone related plantar fasciitis. And then the ability to heal it is just a little bit harder because you don't have that same integrity, and hormones are an important part of wound healing as well. So that's where you could see it. Compound that with systemic wide changes in morphology, connective tissue, perception, just all of those things, and it kind of compounds some of that foot stress. Now, another one outside of plantar fasciitis that I will see in patients, especially in this peri-postmenopausal phase, is it affects the posterior tibialis tendon. And there's something that's called adult acquired flat foot, where, and this is uniquely, it's not only experienced by women, but it's a little bit more, you will see women who are peri-postmenopausal who start to get a lot of stress in the tendon that stabilizes the arch, which is called the posterior tibialis. And it comes around kind of like a J on your foot this way and starts on a bone in the middle of your arch on the inside. And if you start to stress that because of just changes in movement, body weight, your connective tissue is just not as integral, then we can start to lose the arch. So getting one-sided flat foot is something of how this classically presents, and then we'll see this. So what I recommend to patients who are going through this is, one, understanding the tissue stress mechanism, I guess, is we understand our body, we have to understand our foot type, we have to understand the stressors that we put our foot under. How do you incorporate achievable daily foot recovery? One, I would start that habit now. If you are not menopausal, I would do it now so that you continue that through the rest of your life. That could be something that you are thinking about strengthening your feet, just like you strengthen your pelvic floor, just like you strengthen your rotator cuff. Like every part of your body has to be strengthened, including your feet. Understanding if you need arch supports or what are the most appropriate shoes. So it's really kind of going down this foot health path and knowing that it is a critical part of what I consider movement longevity. Is if you're talking about movement longevity, let's say from how do I move well from 30-year-old to 90 years old? Well, you have to have a conversation of hormones in there, especially for women, because that's going to affect the movement, right? So how does it affect the movement? But if I'm in my 30s now, how do I build that habit so I'm almost anticipating the effect of changes of hormones on my foot health and my connective tissue and my foot injury risk? Your foot injury risk will be higher, especially in that menopausal phase.
I love that you're bringing this in. I'm smiling because 2 years ago I had a huge round of PRP on my foot and ankle, and one of the injection sites was the posterior tib or the posterior
Okay.
tibialis tendon that was just so damaged from having not worn orthotics for so many years because I really had tried with the abnormal structure of my foot to try and do it on my own, which, as you know, you recommend, obviously when you can, you want to be barefoot, but there's times, and I'm one of those, where it's actually not really recommended. And so I feel like I've really tapped in at a good time, when I am in the hormonal shift change, but before it was much later, to make the intervention with that, but also to readdress my footwear, so that I can avoid further damage to that area, especially as you're talking about with the hormonal changes that play out even further into the foot.
Yeah.
Um, I also love that you mentioned achievable things. So you use that word achievable, which I want to just highlight and remind for everybody listening, because I know that a lot of people who listen to us get very overwhelmed with that. They hear in the Instasphere, I call it, of all these things that they should be doing, and just remembering that it's about whatever you do, it's about your consistency, right?
Yes.
Making things achievable in the way you were saying. Okay, so I have one other question for you, which is actually about evidence. So we're in this world where, evidence plays a role, and there's sometimes a battle between evidence-based and clinical experience that doesn't necessarily need to be a battle. Tell us something that many people who are either practitioners have experienced and recognize this relationship to the foot and other pathologies or other issues or pains or dysfunctions in the body. But what does the evidence say? Like, we know that often research is slow to catch up,
Mhm.
but what is the evidence showing about what many people either know as a practitioner or have experienced in their own bodies, that there is this clear relationship between the foot and something else playing out elsewhere?
Yeah, so I'm very much evidence-based, but I'm also, some of it's intuition, especially when you start talking about the nervous system, fascia, things that won't necessarily show up on a Western medicine, EMG, ultrasound, CTs, kind of those things. So I'm always very appreciative on both. I'm not into anything gimmicky. I try to do stuff based off of the demonstration of the consistency. So some of what I recommend to my patients is based off of clinical experience, and that I do a lot of regenerative injections for the foot and the ankle, and I will share with the patients clinical experience after doing these injections for 12 years. And that's one intervention where you will see, let's say, mixed evidence around it. And then what I will tell them is, when I do a regenerative injection, whether it's PRP, Wharton's jelly, I used to do amniotic based ones as well. If you look at some of those typical research studies, and I don't mean to go on a side tangent, but when you look at research studies, you really have to understand how to read them. Patients don't know how to read them in the most respectful way, where you have to really critically look at the methodology of what they're doing and what was the protocol before, during, after the intervention, right? In the case of PRP and some of the regenerative injections, is if you inject them and say, okay, bye, have a nice day, I'll see you in, a month, and there's no guidance in the rest of it, and then they say, meh, mixed results of the effect of PRP on plantar fasciitis. That's because the methodology wasn't controlled in the way that it needed, right? So that's just kind of the little nugget that I'll say on evidence, because I see that a lot with the development of the Naboso products, is that I've read dozens and dozens of textured research studies in the development and the continued development of the Naboso product line. And some of the research studies will say inconsistent results of texture for MS, no perceived benefit. And I'm like, whoa, let me look at the methodology. And if you're not controlling socks, what shoes they're wearing, how much cushion in the shoes, right? There's so many variables. So things that I can say in the foot and the ankle that I'm very passionate about, that I recommend to patients, that there is evidence coming out to support it, even though anecdotally it's been demonstrated for a long time to have a benefit, is things related to strengthening the foot intrinsics, the role of the foot intrinsics in supporting the foot structure, the role of the foot intrinsics in playing an important role in absorbing impact forces and then transferring that energy, that a lot of the muscles in the foot and the lower leg simply contract isometrically, and there's actually no eccentric, concentric. They just hold on isometrically, which is why I recommend primarily isometric exercises for the foot and the ankle. Things around just barefoot stimulation for athletes and how it demonstrates there's a lower injury risk that season that they incorporate barefoot movement prep. And that's just supporting the role of the skin in the bottom of the foot. I'm a big fan of vibration training and using vibration to the foot to stimulate the nervous system, to stimulate circulation, and there's more and more evidence behind that. So I would say that for the effect of looking at the foot and the ankle from a alternative way, or a non-traditional Western medicine, surgical, pharmaceutical pigeonhole, there's actually really good evidence that is coming out. And then there's a few things that are still, I have to say, you have to trust my intuition on this or my clinical experience, because it's something that is through the abstractness of human movement that I know you are stressing this part of your body, that I can't pick that up on a sensor that is not sensitive enough to pick that up.
Yeah.
Right. So I think oftentimes it's a dance between those aspects.
Definitely. And I think that was also really great, mentioning some of the critical eye that we need to use in looking at research as well. I was just literally, before we got on, I was reading a paper on something else, but just that has been constantly mentioned, and picking out all these holes that really doesn't apply to the population and the methodology, especially with what we're talking about in this specific area. So I thank you for all of this great wealth of information. And I also have a big little disclaimer to provide here for anybody listening. I was going to have you talk about your Naboso products just for a minute, just to tell them what that thing is that you're holding up. And I want to share that I've been using the Naboso toe splays and also the neural ball for about a year and a half now, actually. And they just, and I say this, nothing, it doesn't help anybody but me, because I want other people to know that the splays are the best that I've ever used of any kind of toe separators. They've been phenomenal for me in my own rehab and recovery with my foot issues and injuries, but also just I'm about to head on a plane overseas in a couple of days, and they're in my bag as always. So I love the stuff. Why don't you just tell people what that thing was that you held up?
Yes. Well, this thing that's not on the market yet. So something that's not on the market. And then the toe spacers that, oh my God, I have everything on my desk. So these were the toe spacers that you were referring to. Yep. They're in blue and clear now. But toe spacers is one of the products that we sell at Naboso. It really doesn't have the technology of all of our other products, but people love them. All of the other products at Naboso are based off of texture, and that's why I had shown that for a moment. And this texture is actually patented by Naboso. It has little tiny pyramids that stimulate the nerves in the bottom of the feet or the palm of the hand. These would be mechanoception. So we went over that in the beginning. That texture is mechanoceptive, or stimulating that specific nerve. And it is a way, so I developed it 5 years ago, and it was developed as a way to help people to connect to their feet even more than they may be able to when they're in their shoes or when they take off their shoes. And I deal with a lot of people with neuropathy. Not that it's only for people with neuropathy and movement disorders, but if you have some neurological decrease in the perception of your feet, I need to do whatever I can to help you feel your feet more. And I consider every stimulus, or not this is what it's considered. Every stimulus to your nervous system is considered noise. So light, sound is obviously noise, but texture, this is weight, vibration, all of that is noise to your nervous system. And we have to be able to perceive or to hear the noise. I'll give that analogy when I tell people. And if someone has neuropathy or a fall risk, or they're going through these hormone changes, so they have just different perceptions of their feet, they're not as connected to their foot and their foot posture, that means I have to turn the volume up to the noise, the stimulus, so they can hear it. But that means feel it, right? So that's the way that I look at sensory stimulation to the feet. Is some of us are just a little sensorily disconnected. Maybe it's just us, we are sensorily disconnected. How can I, through different products and methods that I create, help people connect to that by turning up the noise?
Well, you know, two of the big takeaways I think from this conversation as we tie up are this significance of nervous system and endocrine system that I think people don't necessarily acknowledge or even realize plays such a huge role in regulating literally everything of how we move and how we function.
Yeah.
Well, thank you for joining me today. I'm thrilled to be able to share some of your great knowledge with our followers and to be able to ask you some questions as well. So thanks for being here with me today.
Of course, it was so much fun, and I know we're going to be doing some more stuff soon.
I know. Everybody stay tuned for stuff to come. We have
Yes.
some exciting collaborations down the road.
Awesome. Thank you.
Take care. Bye-bye.